Hi everyone, Dr. Jeff back with you with co-op student Fiona this week. Hope you enjoyed our video last week on coffee, tea, and water. Maybe it changed your habits a little bit, maybe it didn't, but we enjoyed doing it. And this week Fiona's got another great topic for us, and this we're going to talk about
what to expect on your first chiropractic visit.
Yeah, a lot of people haven't seen a chiropractor before. They don't really know what to expect. Could be a little bit nervous. So we thought we'd talk a little bit about what will happen when you first come to the chiropractor.
So when you come to a first visit, you can expect to be here for around 45 to an hour. And to book an appointment, you could do that by coming in here to book, calling, or booking online. And then you'll expect to also fill out some forms online, but you can also come in to fill it out like on your first visit, but make sure to come a bit earlier.
Yeah, get here early to fill those forms in so we can spend all our time looking at you. So the first thing that will happen when you come in is we're going to greet you at the door. So we'll kind of go through this. So the first things we'll do is we're going to kind of greet you at the door. We'll say hello, and we're going to get you back in the room.
Okay, after we welcome you, we're going to bring you back into a room, and once you're in a room, I'm going to start by asking you general health questions and then doing some blood pressure, and then we're going to go over here and take your weight and also your height.
So after Fiona's done with you, it's my turn to come in and talk with you. So I'm going to be a little more detailed in my questions about your general health. Current conditions, past conditions, have you broken anything, do you have allergies, that type of stuff, as far as your health is concerned. The other thing we're going to talk about is your actual complaint. I mean, you got complaining about low back pain, shoulder pain, neck pain, headaches. What's your major complaint? And once we know what your major complaint is, then we can ask you more specific questions as to what happened, when did it start, what are your symptoms, what does it feel like, what makes it better, what makes it worse. We can dive more into the actual problem you have. And what we find with chiropractic is that generally, during our history and our case review, the patient's actually going to tell us what's wrong with them before we even have to figure it out. Because if we take a really good history, then we're going to know exactly what's going on. All right, so once we're done with your case history and trying to figure out what's going on with you, we'll do some orthopedic tests, we'll do some palpation, we'll do some range of motion, we'll do some testing, trying to determine what the issue is. So maybe do things, let's range of motion. So if you want to put your chin down and head back, look at the ceiling, turning left and right, things like that. Next thing we'll do is we may do some compression. So some things like pushing down, trying to determine where exactly the pain may be coming from. At some point we'll get in, we'll start palpating your muscles, and we'll palpate your spine, seeing what's going on in there. And again, looking for pain, looking for the patient to tell us that's sore, that's not sore, things like that. We'll do some muscle work, looking at how tight the muscles are. Depending on what's going on, we may actually get in there and try and see if we can track a nerve, if you're having some nerve pain, seeing if we're pulling on anything. Are we getting any signs of your pain? So if you're getting tingling in your fingers, can I actually do testing that actually will get that tingling in your fingers, so you know that this might be what's causing it. So once we're done your assessment, your examination, that will give you an idea of what the diagnosis is, and I can convey the diagnosis to you that this is what's going on with you. It's the kind of things we might be able to do to help you, and that's the one difference between chiropractic, physiotherapy, massage, and acupuncture is chiropractors are doctors, so we have the right to diagnose. So we'll diagnose what the problem is and go and explain to you a little bit about what can happen. We're going to try and give you your first treatment that day, as long as everything went according to plan, to try and give you a little bit of relief. So generally on the first visit, the chiropractor will actually give you a treatment of some sort to try and make you feel a little bit better. So if Fiona, we know she's got a bit of a stiff neck and a stiff upper back, so we're going to come in and we're just going to give a bit of a treatment here. See if we can make her feel a little better.
So once everything is done, we'll get you in for a second appointment. You could do that. You could book that up at the front. And what basically that appointment will be is that Dr. Jeff or the chiropractor would review your findings and then set up a treatment plan, discuss with you the cost of your treatment, and how many visits that you'll be coming in for.
Yep. everything else that we need to do while you're here, whether that includes the shockwave or IFC, chiropractic. We kind of give you an idea of what to expect when you come in for your visit.
Hope you guys enjoyed our video. Please like it, and also subscribe if you wanna tune into more of our videos. Share it with your friends and family who you think might enjoy it, and also comment down below or ask questions if you have any down below in the comment section. And here goes where your wellness. We got your back.